Hello everyone, my name is Jimmy and thanks again for joining us on Decoding Indigenous Health. This episode will provide an overview of health disparities within Indigenous communities. Much of this information can be found in Andrew J. Jolivet's work called Indian Blood, HIV and Colonial Trauma in San Francisco's Two-Spirit Community. So, if you want to learn more about what we covered today, we empower you all to pick up a copy for further reading. So to delve in, it is important to acknowledge that Indigenous populations experience mortality rates that are higher and vastly disproportionate from white, Black, and non-Black populations of color. This phenomena can be traced to multiple sources throughout history. Forced sterilization within Indigenous communities occurred in the 1970s. In other words, without the consent of the people whom were affected, many Indigenous peoples were stripped of their ability to reproduce, which was a horrific method of erasure. Other methods of erasure have manifested through racial and gender-based discrimination, as well as sexual violence. Let's talk about something called intergenerational trauma. This occurs when various forms of trauma, suffering, or general harm happen to one generation, then in newer generations that pain is still felt and still haunts descendants of the family member who originally experienced the trauma. Intergenerational trauma is often felt heavily within Indigenous communities, whether relating to culture, economics, or spirituality. Historic and present happenings, such as forced sterilization, different forms of intergenerational trauma, destruction of nature, and settler colonialism generally, have continuously added up to Indigenous communities' mistrust for the U.S. government and Western medicine. And although the Indian Health Services, or IHS, are working to provide access to healthcare for these populations, mistrust as well as distance from providers can be a huge obstacle. Thank you for joining us on this episode of Decoding Indigenous Health. If you have any questions or are looking for more information or explanations, please comment below. And again, if you want to read more, make sure you find a copy of Indian Blood. We'll see you next time.